Greetings, everyone, and thank you for joining us today. As cases and hospitalizations continue to rise, our positivity rate north of 11%, I want to explain exactly what the state is doing and will do to prepare for what we call surge capacity, meaning make sure that everybody who has COVID or has another illness like a heart attack or stroke has access to the best quality of care, hospital bed, an ICU bed if needed, the treatment that's needed to give them the chance to get better. First, I want an update on the COVID numbers. The most single cases reported in a day, both nationally as well as in Colorado. Nationally, 194,610 cases. I think the country's going to pass 200,000 cases per day in the next day or two. In Colorado, 6,439. Also a record for Colorado. We also, in a positive way, broke the record for number of people tested, thank goodness, 51,797. It's good that over 50,000 people a day can be tested. We're going to get into the increased availability of testing. That's been a big focus of ours, just to make it more convenient, reduce any lines or waits, more and more testing sites coming online to meet that demand. Why is testing important? Because it helps people identify earlier in the course of the illness that they need to take very seriously the self-quarantine measures. And of course, we also pick up some of the asymptomatic folks who might, without knowing it, be contagious with the deadly virus to help save the lives of others. So these are our darkest days as a nation. They are our darkest days as a state. It's going to take all of us working together to get through the weeks and months ahead with the promise of a vaccine, with the promise of better and better therapies over time. Already substantially better to get the virus now than it was in March, and it'll be much more likely survival to get it in January, February than it is now. It only gets better with time, the treatment, which is another reason to take precaution now to avoid unnecessary loss of life. We currently have 1,159 Coloradans in the hospital with COVID receiving life-saving treatment. Our North Star is and continues to be making sure that we have those available beds, many of them non-ICU, receiving oxygen therapy, in some cases ICU intubated. We want to make sure every person who contracts COVID has a fighting chance of making it through. About 5% of the folks that enter the hospital with COVID don't make it out, 1 in 20. That's not the type of Russian roulette that any Coloradan wants to play. 1 in 20 chance of not making it out if you're hospitalized, which is just another reason to take this very seriously in our lives. Avoid socializing with people outside of our household, wear masks around others, and avoid social interactions. We also, tragically, in Colorado, have 2,234 people who have died due to COVID. Including a dear friend of mine. I think many Coloradans have suffered loss. For some it's their family, for some it's their parents, for some it's a sister or brother, for some it's a son or daughter. And our condolences, and on behalf of the state of Colorado, go out to everybody who suffered loss, not just in Colorado, across the country, across the world. This has been a time of great suffering and loss for so many across the world. Right now, about 1 in 110 Coloradans are contagious with COVID-19 statewide. It's even higher in some areas. In Adams County, it's 1 in 58. In Denver, it's 1 in 64. Statewide, 1 in 110. Just so you kind of see what that means to you in terms of your plans for Thanksgiving and for life. If you have a Thanksgiving group of 10 folks, a size of a Thanksgiving coming in, that means you have about a 1 in 11 chance of somebody being contagious with COVID in that group. Often not knowing it, could be a cousin, a nephew, a niece. We know the danger, of course, intergenerationally in particular, to your older relatives, to those with pre-existing conditions. That's why it is really important, if you do want to enjoy that intergenerational Thanksgiving, to self-quarantine before you risk exposing your elderly relatives to the deadly virus. That should frankly start today if you plan on seeing relatives from other households for Thanksgiving. you should self-quarantine and avoid the risk of infecting yourself today, so you're not unwittingly bringing that in and losing a loved one, a family member who only wants to celebrate Thanksgiving and fellowship with you. And that's a very important caution for people, not to play Russian roulette over Thanksgiving. You wouldn't do it with a gun, and you shouldn't do it with a virus. I have a bit of good news to share as well in our fight against COVID. Last month, the Colorado exposure notification technology went live on Android and Apple phones. We are happy to announce that we have over 1 million Coloradans that have opted into receiving notifications. This is a powerful new tool that is already going to start having an impact in the coming days and weeks on the spread of the virus. We'd like to see another 1 million opt in. Over 17% of the population has opted in. The research models out of Oxford show that at about a 15% adoption, which we've now exceeded, we can expect an 8% reduction in infections and a 6% reduction in deaths. So we're now just above that 15%. Like everything with coronavirus, there's a bit of a lag before you actually start seeing that positive impact. But we really would love to get to that 2 million now as a goal. So simply turn on that notification on your phone. It's very, very easy. You just go to settings on your iPhone if you have it, and then click on exposure notifications to activate. Very, very simple. Just takes 2 moments. Have your iPhone, take it out now, go to settings, and opt in on the notifications. Very, very easy to do. And if you want to find out more information, you can go to addyourphone.com. That's the official site. The tool's working. It'll work better for all of us if more people use it. 17% use. We're good news. Let's get up to 25-30% use and save lives and reduce the spread of the virus. Given the rise in virus across our state, I've ordered the State Emergency Operations Center to return to level 1. This is the highest level of operation for an emergency. This is the operational center where we've had a number of briefings in the past, and we probably will again. Brings together all the different state agencies and response on this emergency. Our federal partners, volunteer organizations that serve our communities in crisis. To put things in perspective, we were at that level 1 from March 1st to the end of May. We now have a higher level of the virus in our community than we did even during that March peak, and we are reactivating level 1 at the Emergency Operations Center so the Operations Center can better coordinate the state's response to the pandemic. Also, as cases increase, we are seeing a corresponding increase in hospitalizations. Surge capacity, meaning how do we serve more people, is absolutely critical to manage the influx of patients. We have 1,159 people currently hospitalized in Colorado for coronavirus. And we all know that if our healthcare system is overwhelmed due to the increasing cases and growing hospitalizations, then people will die who could have been saved. And that's not just COVID. That could be a heart attack, a stroke, appendicitis. We need to be able to give everybody who has something that modern medical technology can cure or fix the opportunity to get that level of treatment that living in an advanced industrial society with great medical care provided by doctors can be offered. The worst case scenario, which it is our goal to avoid, and we will continue to struggle to do so, is that so many Coloradans are sick that there's not enough beds or staff or equipment. And as a result, more Coloradans would lose their life. This was the reason for the strong actions in March. You might recall it was about running out of personal protection equipment. We're in a stronger position now. There was no surge plan in place in that emergency. It hit quickly. Now there is. We have the alternative care sites available to bring online. So a lot of planning and work has gone into the last 6 months to really get us to where we are today with the capacity to better care for those who are ill, both with COVID and with other ailments. I'm going to be signing a executive order that clarifies the order of operations for surging our hospital capacity in the state of Colorado. Many hospitals have made extraordinary steps, but we're providing an increased level of organization around the order of operations. You might remember from grade school, PEMDAS, parentheses, exponents. That's kind of how you do the math problem. For hospitals, the first line of defense is to increase their capacity internally by opening up unused space, augmenting their staffing. Then if further capacity is needed beyond that, they must scale back their elective procedures. There was an outright moratorium on elective procedures early on. That's something that does remain on the table as a potential after the unused space is expanded. And of course, there are some procedures that are more elective than others. So while it could get to an outright moratorium on elective procedures, there are ways to dial that back and delay in some cases, and those would be first. So there's almost an order of operations within that piece. And then third, if patient load continues to surge after the unused space and staffing are activated, after elective procedures are pulled back, and some hospitals are already in that stage now, then we will support and we will continue to support the inter-hospital transfer system. And then the final piece is to utilize our alternative care sites as that tool of last resort. To be clear, those are for non-emergency, non-ICU. What that could do is then allow the hospitals to convert non-ICU beds into ICU beds, with some of the patients with COVID that need oxygen being able to receive care at our 3 alternative care centers, which I will give you an update on as well. So hospitals need to exhaust all their resources before the alternative care sites are utilized. It's always better to keep it under that same roof, and we hope that they will be able to do that through this executive order, which clearly establishes the prioritization, opening up space, augmenting staff, scaling back elective procedures, inter-hospital transfer, and then finally the utilization of alternative care sites. This order directs all hospitals to submit a plan to the state with their maximum surge bed count by Wednesday, November 18th, and a complete surge plan by November 20th, and must include a detailed plan to increase bed capacity by at least 50%. Again, many of them have this plan on paper or are close to it. Some have more. This is simply a centralized way of increasing the efficiency of how we administer this across our hospital system. So there are strategies to increase the number of ICU beds, but how they would transition medical and surgical beds to ICU beds if needed for the minority of patients that do need ICU beds with COVID, and of course for patients with trauma and heart disease and other issues that need ICU beds. A detailed staffing plan that can provide adequate care for their beds, including those in use and available to patients both with COVID and with other ailments, and a requirement for elective procedures to be actively managed, reduced, delayed, or even a moratorium if there is a surge of COVID-19 infections in that county, in that municipality that hospital serves. We also direct that hospitals report the maximum number of staffed ICU beds that can be made available for patients in need of ICU level care, and a maximum number of staffed medical and surgical beds that are available for non-ICU hospitalizations each day. They will update us at 10 in the morning and 8 at night. Again, a lot of this data in different formats we have at different times. This organizes it and requires more real-time updating to better make sure that we can serve the people of Colorado who contract COVID or contract any other type of condition that requires hospitalization. We are encouraging hospitals and medical providers to maximize the use of telehealth and virtual visits as much as possible, free up needed resources, and prevent unnecessary potential exposures. And I want to make something very clear. Under the existing public health order that has been in place for months, hospitals that are at more than 70% capacity or have less than a 2-week supply of PPE need to actively manage their elective procedures to ensure they have adequate capacity for a surge of patients. That has been the law since July. This simply drills down under that to make sure that that is happening and that establishes that order of operations to make sure that Coloradans in need of medical attention for COVID or other conditions can receive that medical attention. We're planning to update these executive orders and public health orders to make it clear that hospitals experiencing stress and strain serving patients must begin a mandatory scale back of elective procedures for the surge of patients in the coming weeks. We are also taking actions ourselves on both staffing, and I'll update you on alternative care sites. We've activated a medical workforce staffing contracts through the State Emergency Operations Center to assist with medical surge needs. This provides additional medical professionals to support service to folks in need. This medical staffing can be used to support hospitals experiencing staff shortage. They could also be used if needed and if opened at our alternative care sites should we have to activate those. We'll continue to pursue additional staff augmentation efforts as one of the reports coming back from hospitals are difficulties with staffing, extra shifts, people that are out themselves under quarantine or with COVID that are part of the medical response. And so that is an area that we want to play a constructive role. We are playing a constructive role. We will do more to support the staffing needs of our caregivers. As a last resort, we have the option of mobilizing the alternative care sites. I continue to hope, we all continue to hope, that we will not use those facilities. But we are prepared to activate them if necessary. And we are a lot closer to that today than we were 2 weeks ago or we were 4 weeks ago. We monitor hospitalization and usage daily, and we stand by ready for action. There are 3 sites in Colorado that can be utilized if needed: the Colorado Convention Center, St. Mary Corwin in Pueblo, and St. Anthony North Family Medicine at 84th in Westminster. The Colorado Convention Center in Denver can open initially with 80 beds, can expand to 2,000 beds within a month. St. Mary Corwin in Pueblo, 25 beds, and it can expand to 240 beds. St. Anthony facility in Westminster would open with 25 beds if needed, and could expand to 78 beds. So we monitor the situation daily to see if the activation of those sites are needed. They are the last in the order of operations, but we do have that capacity that has been built, is ready. It can be activated over a month, some of it immediately, and then over a month, the full numbers that I indicated would be available. Those are non-ICU facilities, and oxygen can be administered at those facilities, the first-line treatment for most COVID patients. And they would, in turn, working with the conversation with the hospitals, if needed, where additional non-ICU beds at the hospital level could be converted to ICU beds with the non-ICU patients at these overflow facilities. But there are several steps before it becomes that dire. But looking at the current trends across our country, including in Colorado, there is a higher likelihood that those might need to be activated. It is still something that is in our hands, in your hands, in our state's hands, in our country's hands to avoid if we show the resolve to do so. As the holiday season approaches, we continue urging Coloradans the best way to keep safe is to only interact with members of your own household. The safest and best option, of course, is to have Thanksgiving with your household. I understand many want to have Thanksgiving with additional households. If you do want to do that, the safest way to do that is to quarantine for 2 weeks before Thanksgiving. That means starting quarantining today, right? If you are going to an intergenerational Thanksgiving with grandma and grandpa or aunt and uncle or cousins, it's important to do that today. And just, again, walking through those odds that we talked about, it's 1 in 110, 11 people at your Thanksgiving, that's a 10% chance playing Russian roulette that one of them is contagious. In a typical Thanksgiving dinner, that would very likely spread from one person to 8 or 9 or 10 out of 11. I mean, this is indoor, intimate contact around a table. So if one person has it, you're all going to have it. Now, you don't control that. I get family dynamics, right? You don't control the decision-making process of everybody at your Thanksgiving table. There's 11 people. You might have that cousin or uncle that doesn't believe in coronavirus and thinks it's a hoax. Your family dynamic may allow that person not to be invited, or they may have to be at the table. But even if 10 of the 11 self-quarantine before they get there, and one doesn't, you've reduced the odds of bringing COVID to Thanksgiving from 1 in 10 to 1 in 100, which, again, it's not fun to play Russian roulette in 1 in 100 chances the bullet's in the chamber, but it's a heck of a lot better than playing Russian roulette with a bullet in 1 of 10 chambers. So however many people can self-quarantine, yourself, your loved ones, your cousins, how can you urge them to do it? This is really important to keep your intergenerational families safe. And again, many families, including ours, are just celebrating Thanksgiving this year with our nuclear family. As much as I would love to see my parents They are both in a very high at-risk group in 76, and my mom having some respiratory conditions. And of course, we're going to visit with them virtually for Thanksgiving, and we can't wait till it's safe to see them again. But for families that do want to get together, and the family dynamic really requires that, and that's something you want to enjoy. The more family members that make that decision to self-quarantine, the more likely it is that you're not bringing a loaded pistol for grandma's head. And that's where we are. I know this is a very difficult time for folks to be away from their families. It's also important when you are out buying groceries at a store, wear your mask. Keep your distance where you can. Again, 1 in 100 people are contagious. It is still relatively safe to shop at a store. You wear a mask, they wear a mask. It's a brief interaction. This is spread largely through 10 or 15-minute interactions with two people in close vicinity indoors. So think about those kinds of reactions, right? And how you can be safe. There's obviously a risk of transmission in all of the activities that occur, but the higher risk is around that close contact for a period of time, especially unmasked. We also are increasing testing across Colorado, over 80 free testing sites, covid19.colorado.gov. We also are partnering with COVID Check Colorado, part of the Gary Community Investments, where they have launched 7 testing sites around the metro area, open to the general public. There's a quick nasal swab PCR test. That's the gold standard, 99% accurate. There's a number of labs that are partnered with to get you test results quickly within a day or two, 3 at max, but usually a day or two from those. Testing is critical to slow the spread of the virus. And if you think you've been exposed, if you're experiencing symptoms, you can visit covid19.colorado.gov/testing, or you can visit All City Stadium at 1495 South Race Street, Cherry Creek High School, 4700 South Yosemite in Greenwood Village, Instructional Support Facility, 5416 South Riviera Way, Aurora, North High School, 3125 Elliott Street, Mountain Range High, 12500 Huron Street in Westminster, St. Vrain Valley School Innovation Center, 33 Quail Road in Longmont, Aurora Public Schools Professional Learning Center, 5771 East First Avenue, Aurora. To make that quicker and easier, I suggest you pre-register at covidcheckcolorado.org. That can reduce your waiting time and make sure you get seen. covidcheckcolorado.org for those sites. And I want to thank Mike Johnston and Gary Community Foundation for their leadership on this initiative and making it a reality, right? Really taking that vision and making it happen on the ground to augment and supplement all of the testing sites the county health authorities in the state are also running. We also have distributed more than 400,000 Binax Now tests. These are the instant tests, primarily to firefighters, people who work with the homeless, youth detention centers in state custody, treatment centers, local public health agencies, 51 partners across the state. The Abbott Binax Now test is a rapid antigen point-of-care test. Uses a card and nasal swab. It's processed in 15 minutes right on the spot, no medical training needed. They're not as accurate as the gold standard PCR test, but even with significantly lower accuracy rates, there's a major public health benefit in preventing the deadly virus from spreading by identifying at least a significant percentage of those who might be contagious. And we're currently implementing usage of these tests for repetitive screening in our major facilities. We hope to make them available soon to critical workforces like teachers and other frontline workers and restaurant workers and others for screening to get back to more capacity safely with the instant test. The gold standard PCR test is over 99% accurate. The Binax test on symptomatic folks is about 97% accurate. It has a lower accuracy rate on non-symptomatic, but the best use for that is repeated testing for folks 3 times a week, 4 times a week for screening. Not perfect, but a lot better than not having that powerful tool. So look, now is the time to show our resolve. We know more about this virus than we did in March and April. We know more about ourselves and our values. We know that we need to do 3 things to change the trajectory of this virus in the United States, right here in Colorado. 1, don't interact with other households and people who live in other households. Protect your vulnerable and elderly family members. Self-quarantine yourself before you go to the Thanksgiving table, or just have Thanksgiving with your nuclear family. Wear a mask, and of course, physically distance yourself to the extent you can. The further away, the safer you are. Our numbers will continue getting worse if nothing is done, if people don't change their behavior. And changing this just comes down to the millions of interactions that every Coloradan has these next few weeks. It's the collective result of all of our decision making. It's a time for responsibility. It's a time for using science and data to help guide your life temporarily in a way that might not be the way you want to live every day, but the way we have to live to get through the next few weeks and months. It's not going to be forever. There's more behind it than there is ahead of us in terms of time. But we have to buckle down. With the holidays approaching, I know it's not going to be easy, but it's what we have to do to help our state. We can do this, Colorado. I know we can. The virus is more serious now than it's ever been across the entire country. If you take one thing away from today's news conference, it's that we should all focus on reducing or stopping our interactions with people outside our own household through this month. We're in this together. We're going to get through this together, and we'll build back stronger. Happy to take questions.
Hi, this is
Jesse?
Snowball to the point where it can no longer be stopped. You're starting to talk now about hospital capacity and these other build-out situations. Is that because you don't think that we can prevent that from happening anymore?
Look, I'm optimistic. I'm a cheerleader for the people of Colorado. I know that the people of Colorado are responsible, and when confronted with risk, will make decisions to protect themselves and their families, which is why we've worked hard to be fully transparent with all the data and decision-making process that we have. But we have focused from the start on making sure we have the hospital capacity and equipment needed to address this pandemic and meet the medical needs of Coloradans. That's why very early on we started construction of the alternate care facilities, and while we've been working with the hospitals all along around elective procedure management, there's a stronger executive order and a clear order of operations now as the situation for surge capacity is becoming very real every day in our state.
Hi, this is Erin Prater with the Denver and Colorado Springs Gazette. A three-part question here. Some counties are blowing through these dial levels in a matter of days, but they remain at lower levels than perhaps they should be at. Is the state being aggressive enough with moving counties? The second part of the question is there talk of travel restrictions among states surrounding us, given the state of the virus in the Midwest? And the third part is, and this may have overlapped with the previous question, I could not hear, is this a lost cause at this point, kind of stemming the spread of the virus? Do we have the collective will to stop this as Coloradans? Thank you.
I hope I can remember all your questions. The dial, people should heed the risk in their community. What does that mean? I don't want people watching this, regular Coloradans, to get caught up on the dial. Everywhere in our state, statewide, the risk is 1 in 110 people are contagious with this virus. So this is good advice, whether you live in Sedgwick County or La Plata County or El Paso County, to reduce interactions with people outside your household. And if you want to have a loving intergenerational Thanksgiving, to self-quarantine to prevent that deadly virus from entering into your home and causing suffering and loss of life, particularly for your elderly family members. So, it's not about the color at this point. It's about a statewide threat and a national threat, because many people, might have loved ones coming in from other areas of the country, which gets to your second question. There are not any travel restrictions on people from other areas of the country. Whether you're interacting with somebody from Illinois or North Dakota or Texas or California or somebody from Aurora or Colorado Springs, there is a significant risk that they are contagious with the virus. We know it's about 1 in 110 here. It's higher in Wisconsin and North Dakota and South Dakota. It might be a little bit lower if they're from California. But I mean, wherever they're from, you should realize that is a very real risk that they are contagious with the virus. If you have visiting family from other states, they should self-quarantine where they are before they travel. And before they visit with you, to help keep your family safe. I got two. What was the third?
I guess the third is this a lost cause, kind of stopping
No,
the spread of the virus in states? Do we have the collective will? And also, I mean, is the dial framework irrelevant at this point?
Well, we have always tried to say people should focus on what it does to keep safe. The dial is more of a public health tool, but from the public perspective, what people want to know is not whether I'm orange or red. They want to know how can I protect myself and my family from this virus, and that's why we're laser focused on telling you how to do that, and people just need the resolve to do that. This is not a lost cause. I will never give up on the people of Colorado or the people of the country. I hope that the president re-engages on this. His leadership now is needed, and I encourage President Trump to re-engage around the pandemic and make sure that he provides the type of information to the American people that can save lives and keep people safe. But as we said from the very start, the goal has never been in our state or anywhere in our country to eliminate the virus. That was simply not a possibility here. It might have been in Taiwan or New Zealand, where they're island nations and they controlled the flow and they got on it early. Our goal has been to manage this and reduce unnecessary loss of life. And that's very much in line with our transparency and details today on the order of operations around how we will meet this increased medical need in the short term, which we are very much expecting.
Hello, Governor. I'm Jesus Carrasquel from Noticias Univisión, Colorado. Gobernador, ayer en nuestro estado se reportaron más de 5,000 nuevos casos de COVID-19 en un solo día. Según los datos, varios condados que ya están en nivel naranja deben pasar a nivel rojo. ¿Tiene usted pensado cerrar el estado o anunciar medidas más estrictas? Y lo otro sería, la capacidad de los hospitales podría verse afectada. ¿Qué ha pasado con el Convention Center?
Hoy anuncié medidas que estamos tomando para asegurarnos que los hospitales tengan la capacidad necesaria para dar la atención médica necesaria si tiene COVID o otra condición. Es extremadamente importante que todas las personas mejorar usando su tapabocas, manteniendo distancia social y, lo más importante, solo interactuando con miembros de su hogar, en su techo. Más importante en este momento peligroso en todo el país y en nuestro estado.
Johan Castellanos de Telemundo. Gobernador, buenas tardes. Mi pregunta va sobre las pruebas rápidas. Si no son certeras estas pruebas, ¿por qué las estamos haciendo? ¿Y es verdad que estamos distribuyendo más de 1 millón de estas pruebas en Colorado?
Sí. Las pruebas rápidas están distribuyendo para trabajadores esenciales como bomberos, la policía y otros. Hay más y más cada semana y hay más y más oportunidades para usarlo. No tiene el mismo porcentaje correcto de las otras pruebas que necesita 1 día o 2 días, pero todavía son una parte muy importante de la lucha.
Hi, Governor. It's Jessica Seaman with the Denver Post. For months, you've been telling Coloradans to stay away from others, to wear a mask. But we're continuing to see record level cases and hospitalizations, and we're hearing hospitals have serious concerns about staffing and capacity. At what point do you say that's not working and we're going to have to take a step that you don't want to take with stay at home?
Look, we have Thanksgiving coming up, and I don't think there's anything that a governor can say or that a health authority can say that is more compelling than your love for your mother or father or grandparent or aunt or uncle. It is that love and the heavy weight that would be on the conscience of anyone who, with eyes wide open, caused the loss of their parent or grandparent. That is the compelling reason that I have confidence that the people of Colorado will make this a safe Thanksgiving. perhaps unlike any other, but a safe Thanksgiving. So, again, it's that love for your parents, for your grandparents, for your aunts and uncle is more powerful a force than anything that a state or governor or CDPHE or a local health authority could possibly say or do.
Hi, Governor. This is Joe Vaccarelli with Denver 7. I actually have two questions on unrelated topics, if that's okay.
Sure, there is other things going on, even though this is, just to put this in perspective, we lost 6 Coloradans in the flood of 2013. We lost 2 Coloradans in the biggest fire season that we've ever had this year. And we've lost over 2,100 Coloradans to this virus so far, and it's yet to run its course, and it will get worse before it gets better. Go ahead.
My first question is about forest fires. So the message from the White House has been that the nation's forest fires are the result of forest mismanagement. And the recent fires here, is the state rethinking how it manages forest land?
Well, we rely on the federal government for most of the forest management. Over 90% of the affected lands in our larger fires were Department of Agriculture, U.S. Forest Service land, Bureau of Land Management, Department of Interior lands. There are, I guess, 3 fruitful areas to look into and sort of underlying causes of the historic fires. The biggest is the fire season, the climate change, the statewide drought. Hotter, drier conditions last longer. That will be the new normal. Second, increased population, demographics, more utilization of our wild areas, higher risk of fires being started through human behavior, as some of the fires were that hit us this year. Third, of course, better forest management, and we certainly look forward to working with this administration and the next administration on better stewardship of our federal lands in Colorado.
And my second question involves federal funding for COVID relief. We understand the state received about $1.67 billion with a deadline to spend that money by December 30th. Are you confident that the state will spend that money by that deadline? And if not, what happens?
I am confident that we will. Much of that went out to school districts and institutions of higher ed, other public affiliates. We do have the ability, if there is unspent money in that final few days, if they are not able to spend their money, we have allowable ways for the state to reallocate that. So we have a backup plan if any of it isn't spent. I mean, is there some jurisdiction somewhere that might not spend it or revert it? We should all keep our eyes on that. It's certainly possible. But I have a great degree of confidence that the vast majority, if not all, the funds will be spent. And if there are local entities unable to do that, we have public health responses at the state level where it could be redeployed.
Governor Chris Vanderveen with 9 News. I want to ask you about your comments in more specificity when you come to your comments on the field hospital, and specifically the Colorado Convention Center. You mentioned that immediately 80 beds could be open, but it would take upwards of a month to get 2,000 beds. When do you need to start saying we need to start doing this? At what point? Because that seems like an awful lot of time to open up a facility. And the other part of the question is there enough staffing to open up that facility for 2,000 beds?
Yeah, so there is an order of operations within our alternative care facilities, and I should be explicit about that as well. And I'm finding my my notes here on it. I have too many pages. The first 2 in that order of operations to be activated would be St. Mary Corwin and St. Anthony in Westminster. So those would be the first 2 that would be activated. Give me a moment here. There's just too many pages here. Maybe you can take some of these, Maria. Let's see here. I'm trying to just get the numbers. There it is. St. Mary Corwin would open initially with 25 beds. Can expand to 240 beds. St. Anthony would open with 25 beds, expand to 78 beds. So those would be the first 2. We do have staffing considerations that are going into that. That is one potential use of the staffing contract that we are already in the process of executing. That staffing doesn't mean that they'll be there. They can also support hospitals. But if those centers are opened, then we do have the ability to staff them. The convention center would be the third. That would open with 80 beds and could expand to 2,000 beds over a month. That doesn't mean there's 0 additional beds for a month. So I want to be clear. It opens with 80. The additional 2,000 are phased in over a month. You reach the complete 2,000 after a month or 5 weeks. And I've had presented to me those numbers, but it's a few hundred every week. So there is the ability to, on a rolling basis, bring these online. The first 2 would be St. Mary Corwin, St. Anthony North. We are not there yet. There is this is, as I said last week, this is an intervention. I hope when Coloradans heard that, they reacted. We won't know for another week on the numbers. Obviously, they're still going up now from kind of that Halloween period. That's what we're seeing now because of the delay factor. But we have that order, and we are taking into account the staffing needs for these facilities. With the immediate work we're doing on staffing, would be enough to likely support St. Mary and St. Anthony or some combination of those.
Hi, Governor. John Daly, Colorado Public Radio. Thanks for taking our questions. I'm wondering, following up on the stay-at-home order, is there a scenario you could envision going back to that? Or, I mean, if not now, when? Is this, it could happen in the future? And if not now, when we have 6,000 cases, when could you see that?
Yeah, I think that stay-at-home order was a very blunt tool that was needed as a strong and decisive action at the time because we were out of PPE, running out, no surge capacity. There would have been great loss of life in Colorado from people that could have made it through had we not taken that course of action in March and April. I don't think this is about, stay-at-homes or lockdowns anymore. There are specific public health tools. There are surge capacity in place. The people of Colorado know how to keep themselves safe from this virus. We simply need the resolve to do so. We have the ability on the medical side to serve the need. We have a much better supply situation with regard to personal protective equipment than we had in that March-April timeframe, and better clinical treatments for COVID-19.
Last questions here. I wanted to ask that a lot of these local testing sites are turning people away early on in the day because so many people are showing up. Is that a problem because of a lack of testing from the state, or is that a distribution issue? And then I wanted to ask, we've talked about how you think people really know what they need to do at this point, and that Coloradans just need to follow the rules. Do you think Coloradans have failed, and that's why we're at this situation? And how do you feel like Coloradans have brought this situation upon themselves?
So we have, the state has plenty of testing supplies. It's our understanding that a few of the local partners might not have enough at a particular site on a particular day, or they might have a staffing issue at that site. We have the supplies. They often supply the staffing, but we are increasing testing sites rapidly. We announced today this new partnership with Gary Community Foundation to do that across those sites in the metro area. We have free, quick, and easy sites that we support across the state. But we have we don't. There's not enough supplies to increase testing tenfold. But for all the demand there is, and then some, hopefully 2-3 times the amount of testing. We'd love to see more testing. It's currently over 50,000. We're thrilled with that. Frankly, we'd love to see over 100,000 a day, and we could support that. But it just needs to be logistically done in the field. These are not all. Very few of them are state personnel. These are county health personnel, hospital personnel. But if folks need equipment, if they need tests, lab capacity, we play matchmaker. We have state contracts with labs. We help local health authorities scale those contracts with labs that can turn it around in a day or two. Our own state lab has increased its capacity significantly, but it's only a small piece of the overall private lab capacity. What was your second piece?
Was you talked a lot about how Coloradans know what they need to do, and they did it earlier in the summer. Have Coloradans failed here, and did we bring this upon ourselves as a state?
Look, I think that one area as a nation where we could do better is if we had stronger messaging from President Trump and the White House. We are able to reach who we reach. I think President Trump reaches additional people that would hang on his words and follow his advice if he were to offer it. We would love to see the president offer the same data-driven and science-driven advice about how to prevent it. But yes, I do believe that Coloradans should know at this point how they can minimize their own risks and protect themselves. And I think it's a matter of the resolve to do it. We've equated this to a marathon. It's a long, grueling race. I've never run one myself. And we're a few miles away from the finish. It's in sight, but we're tired. People are collapsing out of exhaustion. But now's the time to really bear down, to avoid interacting with people outside their households. Look, in the fires, in the floods, we lost 6 people in 2013. We lost 2 this year. Thousands, tens of thousands of people, sometimes on 15 minutes notice, had to leave behind everything they had. And some lost everything they had and were unable to return, and some paid the ultimate price. We're not asking you to leave your home to risk losing everything you have. We're simply saying don't socialize with people outside your household for several weeks. Self-quarantine if you want to have a intergenerational Thanksgiving to keep your family safe. Wear a mask when you're out and about. Not permanently, not forever. We're getting close to the end of the marathon. The first Coloradans will be vaccinated in December, many more in January, February, March, including many members of our most vulnerable population. But for now, we need to show the resolve to do what we know will keep ourselves and our families safe. Thank you.